So earlier on we spoke about sleep apnea, but this sleep apnea weren't like applying it to pregnancy. Pregnancy is quite a special time. So anything occurring in pregnancy is good that we actually describe it as it is supposed to be. You understand? So sleep apnea in pregnancy, right? Sleep apnea is just simply like this. So you are sleeping and your airways are not 100% open for air to be passing. Your airways are kind of like collapsing on each other. Okay, I didn't actually bring, but this image is nice. Okay, so normally air is supposed to be passing freely, but when it is collapsing, the back of your tongue is collapsing back into the throat. You have issues with breathing. This can occur in anybody, but in pregnancy, let's discuss how it can present. So sleep apnea in pregnancy, especially the obstructive one, all right? So the obstructive one, they call the obstructive sleep apnea, all right? So it's a growing concern, affects both the mother and the baby, because if the mother is not breathing good oxygen, it's affecting the baby that is also underneath too, So it's estimated to affect about 26% of pregnancies. Particularly affects women when they are going towards delivery. So what is it? It's a disorder where breathing repeatedly stops. Okay, so it starts. Okay, so it's usually caused by maybe hormonal changes as swelling the nasal passages. The hormonal changes is making some changes in your neck. Hormonal changes that accompany pregnancy. It could be weight gain or fluid retention. It could be uterine pressure on the diaphragm. All right, you understand? So symptoms to watch out for is loud snoring. The person is sleeping and there's a whole lot of loud snoring coming out. You have to watch out for that. All right, so what again? Gasping or choking during sleep, daytime fatigue or grogginess, okay, morning headaches, poor concentrations, or memory loss. Okay, so these are all the things you have to actually watch out for. Then risks during pregnancies, it could actually lead to gestational hypertension. The person is just having high blood pressure, but if you trace it, the problem is actually from, it could lead to preeclampsia, it could lead to gestational diabetes, it could lead to low birth weight, it could lead to preterm birth. You give birth to the baby and the baby hasn't reached, the time to actually come out. So diagnosis and treatment is sleep studies. Okay, you have to confirm, continuous positive airway pressure. Okay. Then lifestyle changes, then you keep monitoring the person, all right? So lifestyle changes is basically a mode of treatment. Weight management, sleep positioning, avoid any drugs that will put you into sleep. So that's it for sleep apnea, if at all it occurs in pregnancy.